Are you confused about whether you need a dietitian or a nutritionist? They sound the same, right? Well, not quite. Understanding their differences could be key to solving some major health challenges you or a loved one might be facing. You see, the qualifications and expertise of dietitians and nutritionists are not just small details, they're game changers when it comes to your health. So, let's dive in and see what sets them apart. Section 1. What's the difference? Let's start with the basics. Dietitians and nutritionists both work with food and health, but they're not interchangeable titles. In the United States, dietitians are required to have certification, while nutritionists may not. This distinction is essential because it affects the services they're legally allowed to provide. Dietitians, for example, can treat specific clinical conditions like diabetes or eating disorders, while nutritionists often focus on broader areas like general wellness, weight management, and fitness. A dietitian is certified by the Academy of Nutrition and Dietetics, meaning they have met stringent educational and professional requirements. Think of them like licensed healthcare providers. On the other hand, the term nutritionist can be a bit broader. Some nutritionists are highly qualified with specific certifications, while others may have minimal formal training. Section 2. Qualifications of a dietitian versus a nutritionist. So what exactly does it take to become a registered dietitian nutritionist, RDN? Becoming an RDN involves a bachelor's degree, at minimum, from an accredited institution, completing 1,200 hours of supervised practice, and passing a national exam. Dietitians also need to stay on top of their field through continuing education. They're trained in medical nutrition therapy, MNT, meaning they're well equipped to work with individuals dealing with conditions like heart disease, kidney disease, or cancer. In many cases, insurance will even cover visits to RDNs. On the flip side, nutritionists might follow a different path. Some opt to become certified clinical nutritionists, CCNs, focusing on personalized nutrition advice based on someone's unique health goals. Others may earn the Certified Nutrition Specialist, CNS, credential, which requires an advanced degree, supervised practice, and a comprehensive exam. A CNS often has specialized knowledge in areas like pharmacology, which can be crucial when it comes to understanding how different nutrients interact with medications. Section 3. What do they actually do? Now, you might be wondering what all of this means for you. What exactly can these professionals help you with? If you're dealing with a clinical condition, a dietitian can offer structured treatment plans to manage or even improve your condition. For example, a dietitian might work with someone who has diabetes to create a diet plan that helps control blood sugar levels. They might also provide counseling in settings like hospitals, private practices, and even schools, where they guide students on healthier food choices. RDNs may work in public health offices or nursing homes, helping larger groups adopt healthier habits. Essentially, they're certified to make specific medical nutrition recommendations tailored to complex health issues. Nutritionists, especially those with CCN or CNS certification, often take a different approach. They're usually the go-to professionals for overall lifestyle changes. A certified clinical nutritionist might work with someone who wants to lose weight, has an autoimmune condition, or is just looking to feel more energized. They can make recommendations about what to eat, how to exercise, which supplements to take, and even stress relief techniques. Some nutritionists even specialize in areas like sports nutrition, keto diets, or digestive health. Section 4. Certifications and what they mean for you. With so many certifications floating around, let's break down what these titles mean. Registered Dietitian Nutritionists, RDNs, have a pretty clear path. They're certified by a national board, and their title is protected by law. Certified Clinical Nutritionists, CCNs, also have specific requirements, like holding a bachelor's degree and passing a rigorous exam. Certified Nutrition Specialists, CNSs, need a master's degree and 1,000 hours of supervised practice. This makes CNSs some of the most highly trained nutritionists out there, as they are knowledgeable about pharmacology and nutritional disorders. But here's the catch: some states don't require certification for nutritionists. In those states, anyone can call themselves a nutritionist, even without formal training. This means you have to be extra careful to verify someone's qualifications if you're seeking professional nutrition advice. Always look for reputable credentials like RDN, CCN, or CNS, and ask about their education and experience. Section 5. Insurance and accessibility. One major perk of working with a registered dietitian is that insurance will often cover your visits. In 2020, the U.S. government recognized the role of medical nutrition therapy in treating chronic conditions like hypertension, diabetes, and kidney disease. This is crucial for Medicare beneficiaries who have multiple chronic conditions, as it allows dietitians to provide ongoing nutritional support covered by Medicare Part B. And now, with the Medical Nutrition Therapy Act, doctors, nurses, and psychologists can refer patients for this therapy, opening the door to a more collaborative approach to healthcare. Nutritionists may also accept insurance, but this is less common, especially if they don't have an RDN credential. However, they're often more accessible for general health consultations, and their services can be more affordable without insurance. Section 6. Other nutrition-related roles. You may have heard of other health professionals like nutrition coaches, health coaches, and fitness instructors. While they can play valuable roles in promoting a healthy lifestyle, they usually don't have the same level of training or certification as RDNs, CCNs, or CNSs. These roles can vary greatly in their qualifications, and they generally focus on broader wellness rather than specific clinical advice. If you're seeking help with a specific health concern, an RDN, CCN, or CNS is likely your best bet. However, if you're looking for basic health tips or general lifestyle advice, a nutrition coach or health coach could be a good option. Just make sure to thoroughly check their credentials before working with them. Conclusion: choosing the right professional for your health. So, how do you decide who to work with? Think about your health needs and goals. If you're facing a specific health issue that requires medical nutrition therapy, a registered dietitian nutritionist is your best choice. They have the training and certification to provide clinically effective nutrition plans, and their services are often covered by insurance. For general health advice, lifestyle changes, or support with things like weight management, a certified nutritionist may be a great fit, especially if they have CCN or CNS credentials. Ultimately, the most important takeaway is to choose someone who is qualified and aligns with your health needs. By understanding the differences between dietitians and nutritionists, you're already a step closer to making informed decisions about your health and wellness. After all, food is powerful, and so is the guidance you receive about it.